Imagine your intimate partners always complimenting you on how tight you are, not knowing that you've been holding back tears because the pain is unbearable. Everything tightens, everything shuts down. Your mind is saying you're okay, but your body is saying, please slow down. That's vaginismus. Not attitude, not avoidance, just your body trying to protect you in the only way it knows how. Hi, my name's Sylvia. I'm a sex and relationship therapist, and I help clients with everything going on outside of the bedroom that could be affecting them inside of the bedroom. Helping clients create not only the sexy life they want, but the sexy life they deserve. And if any part of this already feels familiar, follow for more. So what is vaginismus? Vaginismus is the involuntary tightening of the pelvic floor muscles that can make penetration of any sort really painful, or it can take it off the table altogether. It's not a lack of desire, it's not you overthinking, it's the way your brain protects your body by telling your nervous system that you just don't feel safe enough yet. So here's 10 things that you learn about vaginismus in sex therapy. Your vagina is not the issue. A lot of clients come to me thinking there's something wrong with them, their body's not normal. It's not your vagina, it's your pelvic floor responding to fear, pressure or uncertainty. Your body isn't resisting you, it's protecting you. You start to realize that the tightening is not rejection, it's a safety reflex. For example, I have clients that come to me who are looking to have children. As we go into sessions, we start to recognize that the meaning of being intimate to have children could be one of the reasons their body is protecting them from actually being relaxed enough to receive. You start to recognize that the pain follows a pattern. Fear creates tension, tension creates pain, and then the pain reinforces the fear. In sex therapy, once you start to recognize this loop, it becomes easier to soften it and rebuild it with safety. It doesn't always come from trauma. Shame, pressure, Russian intimacy, and messaging also play a huge role. Even religious rules. You start to recognize that your vaginismus may have developed out of fear or simply never been taught how your body works. You start to unlearn that your vagina is just too small. Your vagina is not too small. You'll start to learn that in intimate settings, your vagina actually expands. You start to recognize that your vagina is normal and that it's just the surrounding muscles that have been going into protective mode. You start to recognize that your mind and body is in sync. A lot of people put meanings on why they're actually being intimate in the first place. Some people want children, some people are doing it for fun, and some people are doing it because they feel they have to. All these things can put additional pressure on your body, and your body does exactly what it's meant to do, protect you. In therapy, you start to learn that if your mind feels overwhelmed or unsafe, your body responds automatically. Shame holds more tension than the muscles themselves. A lot of the clients that I see that have vaginismus carry a lot of shame around how their body is when it comes to being intimate. In sex therapy, you start to understand what exactly is going on in your body. You start to recognize that shame tightens everything and information softens it. Because when you start to understand what's going on in your body, it just feels less threatening. And that alone brings such relief. Reconnecting with your vulva rebuilds trust. In sex therapy, we do a lot of bonding with your vulva in so many different exercises. It could be mirror work, gentle touch, and familiarizing yourself with your anatomy. This alone can help you shift from being fearful of your body to having full ownership of your body. That alone is so enlightening. Dilators aren't about opening you up. They're about teaching your body it's safe again. You start to learn that with pace, with warmth, and with safety, and with gentleness, dilators can be used to help your nervous system unlearn fear and feel safe again. However, in some circumstances, some clients just want to be able to explore their own body through solo play, and being able to penetrate themselves is one of their goals. You don't even have to use dilators. We can start off wherever you feel comfortable, be it Q-tips, fingers, whatever it feels comfortable to you. Recovery is absolutely possible with the right pace and the right support. That allows you to move from fear into comfort and eventually back to pleasure. But once your body feels safe again, and you certainly do deserve the pleasure you want. Vaginismus doesn't mean you're broken, isn't your body being abnormal, and isn't intentionally stopping you from enjoying pleasure. It's how your brain tells your body to protect you when you feel overwhelmed or unsafe. When you start to understand the pace of your body and what your body needs to feel safe, intimacy stops feeling like something you have to survive and something you're able and allowed to experience, allowing you not only to create the sexy life you want, but the sexy life you deserve.